city's difficulties hiring and staff have weakened vital parts of our essential services.
As the city's comeback from the toughest days of the pandemic continues, several city agencies are now struggling with a staffing crisis. 19% of the jobs at the Department of Health are vacant, and the Department of Emergency Management, 22% of the jobs are open. And at the Department of Buildings, the job vacancy rate is 24%.
There are labor shortages across the country. That's well documented. New York City has not been spared.
Council members held a hearing to discuss how the city can find and hire thousands of sorely needed staffers. While many private employers allow remote or hybrid work, the mayor has called for city staffers to return to the office full time. Also adding to the challenge, the COVID-19 vaccine mandate for city employees.
You know, it's tough on a lot of people.
Michael Kane lost his job as a public school teacher when he chose to not get vaccinated. Kane and other Fire City workers stood together at City Hall saying they are willing to fill some of those open jobs if the mayor drops the vaccine mandate.
City Hall continues to treat us differently and discriminate against us.
Earlier this week, Governor Kathy Hochul ended the mask mandate for public transit. And last month, the CDC said the nation should move away from some of the more restrictive measures once used to contain the pandemic. Councilmember Joanne Ariola says there have been productive talks with the mayor to finally drop the vaccine requirement for city workers.
I see that he has changed many of the mandates and repealed many of them, and it is my hope he will continue in that direction.
In Pix 11's most recent polling with Emerson College, 52% of respondents said yes, employees fired for not complying with the COVID-19 vaccine mandate should get their jobs back. And on those negotiations to drop the COVID-19 mandate for city workers, the mayor's office said they would not comment on private conversations, but they did tell us, quote, "We continue to follow the advice of the health experts to guide our response to COVID-19 and ensure the health and safety of all New Yorkers."